delighted to welcome Government Minister, Care Minister Helen Whately to the show right now. Good morning to you.
Good morning.
Good to talk to you again. It's been a very long time, but it's great to have you back on the show. And of course, we know what we're going to talk about, the social care funding plan. It was voted for by MPs last night. 37 Tories didn't vote for it. 5 actually voted against it, but it got through. It's been called the social care funding plan, but as far as I can, and an awful lot of experts can work out, there's no plan for social care involved in this extra £12 billion of funding. And there doesn't appear to be any funding for social care either. When does social care start to actually benefit from all this extra money being raised by our taxes going up?
Well, as you said, yesterday we voted through the new health and social care levy to pay for both clearing the NHS backlog and also social care reform. To be clear, yes, you said a handful of Conservative MPs didn't support it, but Labour did not support it. They actually voted against this more funding for the NHS and social care and bringing forward social care reforms, which is probably an important point to just mention. But overall, to come to the second part of your question, so over the next 3 years, this new levy will raise £36 billion. 16 billion of that is going to the NHS to help bring down those waiting lists, as I mentioned, but also 5.4 billion is going into social care so that we can launch our programme of social care reforms. That's a big, bold social care reform that for decades people have been crying out for, and now we're going to get on and
Right. I couldn't care less what Labour did in this instance because Tories got a majority and the Tories were able to get it through and therefore you own the policy. It's not true that £5.4 billion is going into social care. That's simply not true. A point I put to your boss, the Health Secretary, Sajid Javid, yesterday. It's actually just about under £1 billion a year going in. That £5.4 billion is split between pretty much half any extra funding over 3 years, so not even over just 1 year. But the other half of that money is basically the deal nut proposals, which is the cap on care costs. So that's money that's going to be basically covered by that. But it's not extra money going in. It's just the extra cost to the taxpayer of the cap on social care. So there's no extra money going to social care from that.
So as I said, of the 36 billion over 3 years that we raised, 5.4 billion is going to social care. So I think I was actually clear.
They're not getting an extra 5.4 billion, though, are they? There's actually an extra 1 billion that's going in a year, and that's it.
So over decades, governments have tried to bring forward proposals for social care reform, but the fact is social care reform is expensive.
Yeah.
That's why we have put in place a long-term funding mechanism, this health and social care levy, to pay for the costs of funding reform care system, both in the short term and over this.
In the short term? In the short term?
Well, that's why I said, I think because we're looking a long way into the future, actually. This is a once in a generation shift in once in a generation reform in social care to put in place a new system to give people the peace of mind about the very high social care bills.
Right. Okay, well, again, there's lots of different aspects of social care. They're not all involving people who've got big assets and have to pay social care bills. Something like only 1 in 7 people are in that situation. They have to sell their home to pay for their social care. The care cost cap, £86,000, that's not actually going to be brought in until October 2023. That's 2 years away. What happens to the people in the 2 years up to that? And what happens when, as we discovered in the small print, it only covers the sort of accommodation, the hotel aspect costs of social care, but not all the other costs. So are we still going to see people still having to sell their homes to pay for care because of that?
So you've brought out 2 really important points, which I've been absolutely upfront about talking about of these reforms. So the first is that the cap and also the more generous safety net that we're introducing, so you get help earlier on with your social care costs if you're paying for them yourself, that comes in as of October 2023. I would love to bring it in sooner than that. The reality is this is a big reform. It's complex. We'll need to work with all the local authorities across the country to implement this. So actually 2023, October 23 is simply the soonest that we can go live on that, and we will be working flat out to do that to help people as soon as we can. It's a big reform, so it just takes time.
Capping the cost doesn't involve. You could implement that tomorrow if you wanted.
You couldn't actually, because you need to measure and take account of the amount that people are spending each month on their social care, so that you know when people have reached that amount. So there is actually a process you have to put in place to track.
It takes 2 years.
Yes. Also,
wow, that's efficient. I bet you anything that anyone who's having to, family members and those having to do this with a care home care, I think they'll be able to provide you with that paperwork within a week.
I mean, believe me, Julia, I've asked, how quickly can we do this? And we have already looked, where we can possibly squeeze a timeline to do it in that time.
Okay.
It is a big reform to put in place. And the other point you made, it's really important, so I'm actually drawing it out, is yes, this is for people's personal care costs. People will have to continue to pay, for instance, for their food and some of their accommodation costs themselves. Anybody would expect to do that, planning to do that. The thing that you can't plan for at the moment is how much your personal care costs.
Okay. Let's talk about, though, I mean, there's money for the NHS as well. Obviously, you're the care minister, but we've been speaking to experts on the show earlier today, pointing out that actually you can't increase the capacity of the NHS to this 110% increase with all this extra money that's going in the next 3 years for the NHS if you haven't got an increase in funding for social care, not just for care homes to enable them to take more patients after the elderly patients, particularly after they've been treated in hospital, but also to keep them out of hospital in the first place by providing that sort of care for washing and eating and looking after themselves in the care home. So basically, if you don't plan for social care now and you don't plan for funding for social care right now, you're not going to be able to achieve that boost in NHS care. And actually, this is simply not being thought through. There isn't actually a plan, is there?
There absolutely is a plan. A huge amount of work has gone into this, and as you say, you're absolutely right to say there's an intimate relationship between health and social care, and the NHS being able to do what it does relies on us having a social care system in place. That's why these reform proposals include money going through into local authorities to support them with the rates they pay for care. Also, a package of over 500 million training and development for the health and social care workforce and wider support, because that workforce does such a valuable job. We really want to support them and to respond to the calls we've had from that workforce for wanting more opportunities, more career development. So that's a really important part of the reform package, as well as you say, extra funding going directly to the NHS.
Well, and that extra funding for the NHS, how happy are you about the fact that the first announcement we hear about this funding in the NHS is 42 new chief executives of integrated care boards being paid between £200,000 and £270,000 a year for those jobs? Is that really a good use of taxpayers' money?
I mean, yeah, I want to see the use of hard-earned taxpayers' money that goes to the NHS being really well spent and really.
So that a good use of taxpayers' money?
So, I mean, the fact that clearly those are big salaries. What I do know from the NHS is those people will be taking huge amounts of responsibility.
Oh,
they will have
goodness.
Let me just say, they'll have oversight of over 1 million people receiving healthcare. There will be fewer managers as part of this change, and then those who will be in those jobs will be having greater responsibilities and oversight of billions of pounds.
Greater responsibility, £270,000 a year. I mean, that's almost double what the Prime Minister gets. That's almost double what more than double what your boss gets. I mean, really, do you not have any responsibilities as ministers? You don't get paid these salaries. Why does a chief executive of an integrated care board need to get paid £270,000 to do the job properly? I mean, heart surgeons aren't paid that. You can be a registrar brain surgeon, open someone's skull up and operate on their brain. You're not paid that much money. I'd have thought that's quite a lot of responsibility.
For sure, absolutely. I mean, I know if I was paid at that level, of course, there would be a substantial level of scrutiny. There already is over the amounts that ministers.
Should they be paid that amount of money? Yes or no?
I don't think it's a yes/no question like that. You make it sound simpler than it actually is, and the NHS is setting this pay. But I think what we are absolutely right to do, and you're doing it in this conversation, asking the questions as you are, is making sure that the money that goes to the NHS should be well spent.
So is that well spent money? That's what I'm asking you.
Let me say, the thing that I'm really focused on in the part of my brief, which is to do the NHS, is making sure we've got the frontline staff that we need, making sure that we're on track to have 50,000 more nurses in the NHS, by the end of this Parliament. We are already on track on that. We've got now around 9,000 extra nurses at the moment compared to this time last year, more doctors as well. That's really important.
Okay, but we're told that the NHS is constantly told they're short of money. They can't afford to hire these people. They can't afford to keep people because they can't afford to pay extra money for the people who are on the front line, the nurses and the doctors, all the people involved in the clinical side of things. And by the way, the hospital porters and the cleaners who do the stuff on the front lines and don't work on Zoom calls every day throughout this pandemic. And yet they can afford to pay £270,000 a year to 42 chief executives, £75,000 a year to a diversity, equality and goodness knows whatever inclusion managers. This is not an organisation that is being careful with the pennies, is it?
Well, there's not a lot more I can say on those particular salaries that you're to your question. That what I will say is overall, I want to make sure in the scrutiny that I do as part of my ministerial role, making sure that the NHS is really targeting and actually not only targeting the funding, but also supporting the frontline workforce who are doing those very difficult jobs.
Okay, well, talk about frontline workforce. Some of those are not doing a very good job in terms of the management of those care homes. Rights for Residents is a group that I know have been desperate to have a meeting with you for the last 18 months. That they've been representing those family members desperate to see their loved ones for many months, banned from actually seeing their loved ones. Some people, loved ones dying of dementia and Alzheimer's, never understanding why they've been abandoned by their family members, eventually allowed to meet half an hour with a plastic glass in between them, not allowed to hug. Unbelievably cruel. Eventually you did say that it should be allowed by residential homes that family members could visit, but we know thousands of families still are not allowed to visit their loved ones, to hug them. They can have PCR tests, vaccinations coming out of their ears, and they're still not allowed to be with their loved ones. When are you going to follow the advice of Harriet Harman and others who've campaigned on this to actually make it mandatory, required, that care home managers allow families to visit their loved ones in residential care homes?
This has been one of actually for me, the hardest things of the pandemic, trying to work out how we can both keep residents in care homes as safe as possible, while knowing that visiting is so important, both for those residents themselves and actually for the family members who visit them. And the heartbreaking stories, and I've spoken to individuals themselves where husbands and wives, for instance, have not been able to see each other for months because of the visiting restrictions. That's why we've worked so hard with the sector to put in place testing actually to enable person visits as the rates have come down and as we've had access to the tests, for instance. Also put in place systems that enable people, if they're finding they can't visit their family members, to contact the CQC and let the CQC know.
Why should they? Why don't you've given advice. This government has been you've been able to restrict millions of our lives on emergency legislation. You can send out a message very, very simply to every care home company and manager in the country and say, you are required under the law to allow family members to visit their loved ones. And yes, they can ask them to have PCR tests beforehand, obviously every precaution taken, but allow them to hug, to touch, to meet with their loved ones, not for just 20 minutes or half an hour, to spend time with them as they often used to do all day previously. They're no more a risk than the care home workers. They're not going to want to put their loved ones at risk or anyone else in the care home. You could do that with a flick of your pen today. Why have you not done that?
Well, I wouldn't say that legislation is as simple as a flick of a pen.
It seems to be these days.
Really not the case. You do need to think through, for instance, the unintended consequences of legislation and make sure you put in place something that...
What about the unintended consequences of not allowing family members to see their loved ones? Of them dying alone, miserable, of them deteriorating because they don't get that loving care?
Do let me speak. That's what we have... Instead of taking that approach, what we've put in place is the extensive guidance about the process that care homes should be taking, and also a channel through the CQC, also you can do it through your local authority, where family members who are not able to visit for some reason have a way of raising that. We then actually look into, and CQC looks into the individual cases, and generally what they've found when they have been contacted by a family about not being able to visit is it's because there's specifically an outbreak in progress at their care home. and so it's not been safe to visit at that particular time.
No, what we're seeing again and again is families being told, well, one member of staff has been diagnosed with COVID, they're off. So it's 28 days before any more visits are allowed. 28 days. And then they've got a date booked to visit again. And then they're told, oh, there's been another person, another 28 days.
Well, this was happening a while ago, but I'm really not hearing it coming through to me as happening right now.
Why don't you agree to meet with the campaign group Rights for Residents? They've been campaigning on this, representing thousands of families. Why don't you meet with them and then let them put their concerns, and then you could reassure them? If it's all so easy and reassurable, why don't you do that?
I actually have already met campaigners on exactly this, in order to talk through, and had actually a really reasonable conversation talking through the steps that we are taking in order to make sure that visiting can happen. As I say, because I feel personally so strongly about it, and I know from my own visits to people in care homes how important those family visits are. So that is why actually I have spoken to campaigners about it.
All right. Thank you so much for joining us. Helen Whately, Care Minister. It's really good to get you back on answering the questions that I know a lot of my listeners want to know the answers to. Thank you very much indeed for that.